Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today, November 18, 2025, this video is on a New England Journal of Medicine article published on November 17, 2025, titled Fish Oil Supplementation and Cardiovascular Events in Patients Receiving Hemodialysis. There's an accompanying editorial titled Fish Oil for Patients Receiving Hemodialysis, Red Herring or Great Catch. Cardiovascular disease causes over 75% of the deaths in hemodialysis patients. Preventive therapies are limited. The study investigators randomized 1,228 adults from 26 sites in Canada and Australia. The intervention: 4 grams per day of fish oil, 1.6 grams of EPA and 0.8 grams of DHA versus corn oil placebo. Mean age of the cohort 64 years. 56% were diabetic, 85% had hypertension. Median duration of dialysis was about 2.3 to 2.6 years. The primary outcome, it was a composite of major cardiovascular events: myocardial infarction, stroke, cardiac death, peripheral vascular disease, amputation due to peripheral vascular disease. Analysis: Prentice, Williams, Peterson gap time model, Cox models for first event. What did they find? Primary event rates was 0.31 versus 0.61 per 1,000 patient days. Hazard ratio 0.57. For myocardial infarction, the hazard ratio was 0.56. For stroke, it was 0.37. For PVD amputation, the hazard ratio was 0.57. Serious bleeding, 4.8% versus 7.6%, no safety signals. Limitation study, only hemodialysis population. Potential off-protocol Omega-3 use. Limited biomarker sampling. Key takeaway: EPA or DHA significantly reduced cardiovascular events in hemodialysis. The accompanying editorial says that in this trial, the Pisces trial, showed 43% lower rate of serious cardiovascular events with 4 grams a day of N3 PUFA. Benefits are consistent across myocardial infarction, stroke, peripheral vascular disease, and cardiac death. Mechanisms postulated include anti-inflammatory, antithrombotic, and antiarrhythmic effects. However, the editorial urges caution. Early striking results often fail replication. They emphasize that confirmatory trials are needed. Clinical pearls: hemodialysis patients have very low EPA DHA levels, enhancing the impact of supplements. A dose greater than 4 grams per day may be required for effect in advanced chronic kidney disease. Fish oil adherence is confirmed via plasma phospholipid EPA rise. The cardioprotection likely multi-mechanistic, antiarrhythmic, anti-inflammatory, and antithrombotic. These findings complement the findings of reduced trial, contrast with the strength due to formulation differences. The reduced evaluated eicosapentaenoic cardiovascular outcomes trial. The strength trial looked at omega-3 carboxylic acid outcomes trial. The fish trial, omega-3 effects on hemodialysis graft outcomes. The Pisces trial, which is this trial, is the expansion of the acronym is Protection Against Incidences of Severe Cardiovascular Events Study. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.